Hello, I'm State Representative Doyle Heffley, and welcome to Legislative Report. I'm here at the Naden-Hutton campus of the Blue Mountain Health Systems in Lehighton, PA, to talk a little bit about House Bill 1939, which I have proposed in front of the State House to promote a Medicaid reimbursement for telehealth services. As we look across our state and we talk to medical professionals, one of the interesting things that we have coming up in technology in the medical profession is telehealth. This allows for patients in rural hospitals like the Blue Mountain Health Systems to gain access to specialists throughout the state. Right now, Blue Mountain Health Systems is working with Lehigh Valley hospitals to collaborate telehealth services. Patients can be treated here in our rural hospitals by doctors that are 30 miles or an hour away. It allows those patients to remain in our small hospitals here and creates jobs in our community and provides a greater access and quality of care to the patients. I think it's an important piece of legislation, an important step in bringing about some of these new technologies and bringing them to the forefront here in our rural communities. Blue Mountain Health Systems has been on the cutting edge of these technologies. They've implemented this telehealth services this past year, and it's working very well. They've seen significant savings in having to not have to transport patients. They've utilized the services over 39 times, and 31 of those times they were able to keep the patient in our hospital system here. That keeps the patients from having to travel, loved ones from having to travel hours to see their patient, to see their loved one in the hospital, but also keeps those patients here in the community. We're here today at the Naden-Hutton campus of the Blue Mountain Health Systems, and here today talking about telehealth with our guest president of the medical staffing here, Dr. Hanley, and also Susan Jansen, the director of nursing of the nursing unit. Dr. Hanley, if you could just briefly explain a little bit about telehealth and what it's meant here for Blue Mountain Health Systems, how it's helped out with patient care at the hospital.
Yeah, this is really taking us to another level, providing a higher level of care to the community here. It's enabled us to be able to contact specialties that are not available to us here at Naden through our affiliation with Lehigh Valley. We're able to contact physicians such as infectious disease, and now with our moving forward with the OB department, we're able to have a live conversation with these physicians, and patients are allowed to interact with these physicians through this technology. And it allows for better patient care, allowing for us to keep them at home, if you will, and allows them to have the quality of care that you would expect in any tertiary care hospital.
What kind of confidence does that give you as a medical professional, as a doctor, to have that second set of eyes and ears and that, have that access?
I think as this technology unrolls and where it is with regards to accessibility from each specialty, I think it's going to add to the confidence as a generalist, which I am, to be able to care for and provide patients with that higher level of service. Realizing that there are some things a community hospital can't do, and those physicians can recognize that through the teleconferencing. We would transfer them to the higher level of care as needed. But the majority of things community hospitals can care for, given the proper guidance by these physicians. So it makes us much more comfortable to care for our own.
And also one of the aspects of this, the biggest concern obviously is patient care and making sure that patients have the best access, but also in these days of budgetary constraints, the cost savings to the hospitals in the fact of not having to transport patients. I think the report one mentioned earlier, I think Susan had mentioned there were some 39 patients who have utilized the system already, and 31 of those patients were able to be treated here in our smaller hospitals. And you talk a little bit about the cost savings here.
Yeah, that's tremendous. There's several areas of cost saving. One, the cost of a transport in and of itself. Community hospitals tend to be less expensive than the tertiary care hospitals with regards to treatment. And what they can charge, whether insurances or the patient by themselves. I think also the utilization of the intensity of service differs between a community hospital and a tertiary care hospital. The super specialists, if you will, are really for a unique set of patients, and 95% of them are not the ones we're caring for through telemedicine, or all of them are not through who we're caring for through telemedicine. We're able to keep them at home, keep them at lower cost, and get them better utilizing their own doctors in their own backyard hospital. And that's really the nutshell of it all.
I know one of the things that has been concerning to a lot of folks in the medical profession and across the state is the amount of doctors that we have practicing medicine in the state, in our state, and this here is going to cut down. If we have doctors that are traveling 3 hours to see a patient, or a patient traveling 3 hours to see a doctor, is really going to provide a lot more access. And
I think it's a great opportunity to make us more efficient. Doctors, doctors really don't have to be on site for consultations, so they actually evaluate patients with nurses who are trained to do this technology with them. I think you'll be doing a tour later. You'll see just the diagnostic capability of these things and the ability to communicate with the patient. It really is exceptional, and bar none, every patient has been very satisfied that I've come in contact with through the telemedicine with the care they received. And they did feel like they were being escalated with regards to the care they were getting.
And Susan, what does that mean as far as training for the nursing staff to utilize this equipment? Is it something that's easy to use? Is it an easy system to follow?
It is. The equipment itself was very easy to learn to manipulate, and since there's different components of it, we have an exam camera where you can get very specific onto a particular wound or an aspect of care. There's an electronic stethoscope where you can listen to heart and lung sounds here, and they can hear it at the other campus or in Allentown if we're doing the consult with Lehigh Valley. So it was just a matter of learning how to turn them all on. They're very self-sufficient, work very well. The larger part of the training that we did as well is we sent the staff to Lehigh Valley with the infectious disease docs so that they knew what kind of information they would be looking for to be presented to them, again, to make it the most efficient consult for the patient. So the nurses knew what kind of information they should have prepared for the physician.
And one of the aspects of this telehealth is keeping jobs in our local community hospitals. I mean, what is the number of employees that Blue Mountain Health Systems has right now between them?
We are at around a 1,200 employee between the two facilities and all aspects of the health system, not just the care providers.
So it's 1,200 people that are employed through this system.
Correct.
And now, so being able to keep the patients in the system or coming back for the treatments here, you're looking at whether they be physicians, nurses, nurses assistants, or physical therapists, or all that realm is really being able to keep those jobs in our community, and people are seeing that treatment with people that they know rather than having to travel.
Correct. It has really allowed us to elevate the level of expertise that we need on particular patients, and yet we're still able to remain with the patient here at our facility, so we don't have to worry about any of those jobs being in jeopardy because we don't have that service available here, whether it be additional labs, radiologic studies, any of those kind of things.
Well, it seems like a natural move forward to utilizing some of the technology that's out there. I know that I can sit at home on my computer through Skype and talk to my in-laws in Florida. And pretty much that's the same type of technology that we're seeing here, the ability to really utilize. And some of is there a lot of cost in that technology and those upgrades to bring this stuff online?
I don't think so, but I think it's important that people know that the data that's being transmitted is protected. It's not going to be out there on YouTube one day. That's very important, and every patient gets a certain rollout of the information. That's who's getting the information, and also there's an introduction of who's in the room, and I'm sure they'll go through that again. So that technology, while it's there, is protected in the hospital zone, and it's protected a lot. Mm-hmm. So the identity of the individual and the information being communicated remains very confidential.
This is strictly as a communication device. There is no recording going on in order to, and obviously all these talking with doctors is protected by HIPAA. So it's not. There's not going to be any kind of. This isn't going to be on the internet or anything like this. This is strictly communication via from one room to another room.
That's correct. And at the end of a session or a consultation, The physician at the other end will simply dictate his consultation as if he saw the patient here. It'll go through our system, end up in the patient's record, medical record here, where it can be accessed by the other caregivers.
And I know in the hearings that we've recently held in Harrisburg regarding telehealth, my proposal is House Bill 1939, which would provide for Medicaid reimbursement for telehealth services, which could really then expand greatly this technology in having that Medicaid reimbursement. But even in talking to, I know the University of Pittsburgh and the Children's Hospital, and Pennsylvania is one of the most rural states. Actually, it's the most rural state east of the Mississippi. So if you look at our small community hospitals like we have here in Blue Mountain, whether it be the Palmerton or the Lehighton campus, this is something that really is going to impact our area.
I think it's money well spent again, because it's a access to quality medicine at a lower cost to the individual and to the insurance, if you will.
So it seems like a slam dunk. We're keeping jobs in the community, providing a better level of access of care for our local patients, and above all, the biggest thing is it's something that's really going to save lives and also increase the quality of life. What I see as a potential is really being able for patients to come in shorter stays in a hospital, earlier diagnosis. So I commend everybody here at Blue Mountain Health Systems for really kind of taking the bull by the horns and leading on this issue in the area, and having that great partnership with the Lehigh Valley Hospital Systems to move forward. And I'm hoping that we're going to be successful in our attempts here in Harrisburg to get that to get some kind of Medicaid reimbursement and get the state more involved in these technologies.
That'd be great, because it's clearly raising the bar.
Well, thank you. And thank you very much for your time today. I know you have a busy schedule and patients to see, so I don't want to hold you up any longer. And thank you both very much for your time.
No problem. Thank you.
Thank you.
Did you know that Act 16 of 1999 honors one of the greatest leaders in the Pennsylvania House of Representatives? The Matthew J. Ryan Legislative Office Building, once known as the Capitol Annex, is located next to the main Capitol building and honors the late Speaker of the House, Matthew J. Ryan. Those who visit this building will observe the magnificent architectural designs providing eloquence and grandeur to the building. Known as one of the greatest members in the history of the Pennsylvania State House, Matthew Ryan started his career in the legislature in 1963 and was elected Speaker in 1981. His charisma and knowledge will forever be reflected in the building now named after this great legislative leader. Now you know.
Today we're here at Blue Mountain Health Systems at the Naden-Hutton campus with Stacy Scheckler, who is a patient care coordinator and registered nurse here for the Blue Mountain Health Systems. We're talking a little bit about our telehealth proposal that we have, and also some of the benefits that we're seeing here in our local community hospitals.
Hi.
How you doing, Stacy?
Very good.
If you could just give us a brief overview about some of the cases that you're seeing here and how the system works.
Okay. Well, we've had about 30-some consults in the almost year that we've been doing the consults here with the infectious disease doctors, and it's gone very smoothly. We've seen all types of patients, from Lyme disease patients to people who had maybe work-related injuries that receive infection, cellulitis from that type of injury, patients who are septic that have blood diseases, complicated pneumonias, and so on, complicated wound infections, maybe they were pressure areas, or they could be maybe complicated post-surgical complications there. So we've been seeing a variety of patients there. What happens is our infectious disease doctors, when they're consulted, they come on. We're prepared, knowing their the patient's history, their height and weight, their allergies, what medications they've been on previously, any course of antibiotics they've been on. If they were as an outpatient, maybe they got from their family doctor some antibiotics and that failed. Their treatment failed, so they had to be admitted for inpatient treatment.
So what this system does then is so the patient already is talking to the doctors you have on staff, and
Right.
what the telehealth can do then is actually bring in that second set of eyes and ears and
Exactly.
and make that suggestive diagnosis.
Exactly. It saves time for the patients and for the doctors because the doctors don't have to travel from somewhere else to do the consultation. It also saves legwork for the patients. The patients don't have to run and run anywhere to the valley or anything. They can stay right here at Blue Mountain where they're comfortable with their own doctors, whether it's their own medical doctor or whoever recommends the consult. They'll come. We bring the camera we bring them to a designated room, the patients, and have the camera and everything set up there. And then we always have an appointment time. They're pretty spot on as far as getting that time. That if it's 11 o'clock, by 11:05 we're talking. We're prepared ahead of time by having the chart there and talking to nurses. Sometimes I will do the consult myself. Sometimes I'll have the nurse come in and also and there'll be two of us doing the consultation, depending on the severity of what's going on with the patient health-wise, and if there's any new developments in their condition. We look up their labs, their cultures, all those things ahead of time, so we can have that discussion with the doctor.
So the doctor has all that information coming into the sit down and meeting. I mean, you're just looking at what I see as a significant cost savings, obviously. We're looking at not having to transport patients out of our system, and then also the ability for this technology to keep patients in our local hospitals so their families and friends can have access to visit them. But also, ultimately, what I see as a great potential here is just the quality of care that the patients are going to receive in their community hospitals. And it's about saving lives and getting people in and out of the hospital and back home and healthy.
Right. The overwhelming majority of what the doctors recommend, the treatments, can be done right here at Blue Mountain. They don't have to go to Lehigh Valley to get that advanced level of care. We have that level of care here. We have those medications present. Maybe we need the infectious doctor to have the permission to order a few of the medications because they are restricted more to the infectious disease realm, so that those antibiotics are not overused out there and that we're not creating more, what they say, super bugs. Those type of things. We have, as far as the being close to home, we've had many families that have participated in the consults as well. They are welcome, whether it's a spouse or a daughter or son, they're welcome to come in and sit in on the consultation and provide more information than the patient maybe even remembers that they can give. Sometimes your patients can't always be a good historian. So just like a doctor's visit, if normally a daughter goes in with mom to see the doctor, well, they can do the same thing here.
So this is a cutting edge technology. It's something that's really going to move our medical profession into the 21st century. And regarding the patient care, obviously that's the first concern. But also it's going to keep a lot of jobs in our local communities. You're looking at nurses such as yourself, or physical therapists and assistants, and keeping those patients in your community hospitals, keeping those local jobs in our area. And I think that's another aspect where this is going to really help out. Maybe you could elaborate. I think you had said there were some 39 patients who were diagnosed using this, and 31 of those patients were able to stay in the system.
So and the overwhelming majority, everyone has been pleased with the way that the consults have gone. Sometimes they require repeat consults, and now you think if they would be home, or you think about all the running that you have to do back and forth to see doctors, especially when you have complicated health problems. And we're able to keep them here, give them the treatment they need. We don't have to run them down to Lehigh Valley. Then they are discharged from Lehigh Valley or another health facility, and then something happens, they have to come back in. We're able to finish their course of treatment here, follow the recommendations of the infectious disease doctors. Sometimes they go home on home care, so that they can use our home care services and go home with extended IV antibiotic therapy. Sometimes they come in daily here. They'll get a PICC line with this peripherally inserted central catheter, and they'll get that to receive their antibiotics daily at home, and then they'll come in, or they will come into our short procedure department and finish their antibiotic course.
Well, I know, mentioning Lehigh Valley Hospital Systems and in the conversations we've had, how closely they have worked with the Blue Mountain Health Systems to provide some of these services and some of these specialists that they may have an infectious disease specialist on staff there. And obviously, we're limited right now. We're seeing across the state a reduction in the amount of doctors we have. So this is really a way to utilize that doctor rather than having the patient to travel an hour down and an hour back, or maybe the doctor for having to travel 2 to 3 hours in a vehicle. We're able to meet patients that whole time, be much more productive.
Right. And sometimes, you think, how long does it take to get into a doctor's appointment sometimes? So you schedule for a specialist. This, we can get them in the next day while they're here at the hospital. So it's been wonderful.
That sounds like fantastic technology. I'm very happy to be able to putting this idea forth in the General Assembly and working on solutions to help out our smaller hospitals. And maybe we could take a few minutes and you could kind of demonstrate and show us how the system works.
Okay.
Okay, Stacy, now we're going to dial up the doctors on the other end of the line here, and see how this process works.
All right. So I have a number in here. We're calling them. And we're actually calling.
Hello again. Hello.
Hello.
Again.
Here we are.
Here we are.
Great. Here we are. Good. And what I usually do is I usually hit the layout button. I usually get us in the corner right away so that I know where our positioning is as well.
Okay.
So that we know that we're, that the doctor can see us and we can see the doctor.
All right.
Are you flickering on your screen?
A little bit.
All right.
Yeah. Okay.
That's because we're nervous.
All right. So the primarily what we've been talking about is some of the benefits of telehealth services and how our system here, Blue Mountain Health Systems, whether it be the Palmerton campus or the Lehighton campus, has utilized this technology in treating patients and keeping them in our local facilities. What we'd like to do now is just kind of show how, if a patient was here in the room with us, how this technology would work and how the doctor could make that diagnosis or the suggestive diagnosis. So Stacy is the trained our professional staff member here.
Would you like us to talk to them?
Yeah.
Okay. So what we do is usually where Dr. Miller is there on our screen and where Jen and Tammy are is where our infectious disease doctor usually is when he calls in. Sometimes we have one of our physicians on this end talking to the doctor directly to doctor to doctor to get some more information, to provide some more information. So it's really also been a useful tool for both of them, for our physicians and for their physicians to speak together, and a great learning opportunity as well for our doctors.
Now the cameras that you use, I would imagine these aren't just your average video cameras. I would imagine they're a better resolution than...
Yeah, it's not just the regular, what you have on your webcam on your camera there. It's quite a sophisticated piece of equipment there.
And now, if a patient was here right now and we were diagnosing them, and say if it was, I know one of the things that you talked a lot about in utilizing this was infectious disease or burn victims. Is there a way that you can actually get a better view of that injury? Do you have portable cameras as well?
Yes, we do. First, what we could do is we could either zoom in on the regular camera there. So we do the zoom feature, which I can just show you. Well, we can zoom into them as well, but right now we're showing on our camera there that we can zoom in. So that's your first basic method. The other method here is, excuse me, this is our portable camera that we can use, and it even has a freeze option so that maybe you're a little shaky or you're trying to get a clear picture for the doctor, and you can freeze it, and that helps them get very good images.
Well, I think it's remarkable right now with the technology of just sitting and having a conversation with doctors and nursing staff at another facility, and I think that really shows how graphic and how detailed some of this video can be. All right.
So now what I'm showing here is the little portable camera. As you can see on the screen, what I can do can show.
You wanted to show how detailed the camera can be on the screen. I'll volunteer my hand.
Okay.
If you'd like to.
So
just
there
see.
You can get very close as you need to look at your hand, so that you can see all the little lines in your hand and all that. As we're moving here, I can hit the freeze button. I can freeze it so that they can examine something in detail, the physicians as well, and then unfreeze it again. We do not take photos with this. It's just a camera. So.
And one of the things that you had stated earlier was due to obviously the privacy protection. When people talk about these technologies, they sometimes can get concerned with privacy. That this is just a communication device. There is no recording or anything else being done. It's just strictly communicating.
Like we said, it's just, we say it's similar to your video chat on your computer at home. We're not recording anything, though. We don't have the capability to record anything. So people are assured that it's a private conversation. When we start out our conversations with the physicians from our doctors that we speak to, they always make sure that the patients know that it is a private conversation, it's protected, confidential information.
All right. And Dr. Miller, if you could just briefly talk about some of the benefits that you've seen here through the Blue Mountain Health Systems and utilizing this technology.
Yeah, it's really state-of-the-art. It's becoming more and more popular. When we have patients that need a subspecialist and we get stuck with a problem or need their input and their assistance, it's fantastic because they can be at their facility. They can see and evaluate, get a rundown from the nurses and make us strong recommendations. They also communicate with the patient, too, on what their plan of approach is. And especially for facilities, for example, our facilities may not be able to support an infectious disease physician full-time. But so having someone in a way who can help us in the state-of-the-art is very important. And as you mentioned, burn centers, other things that we have that we can keep here, that people want to stay in our facility, that we may have it. Also, maybe, for example, our pulmonologist, if he's on vacation and we need some pulmonary support, we can now have pulmonary support and not have to worry about transferring someone out of the area in the facility. Obviously, people need to take a vacation out and then and get some rest, So these are all the things that are a big advantage to our hospital and to other small hospitals that maybe are, around the country. If you have we're going to be able in the future, if you have a patient with amyloidosis and you want to talk to Boston University, which is the mecca for amyloidosis, I mean, you could, in theory, connect and talk with a specialist up there and have them communicate with the patient.
Well, I think this is really going to bring in a whole new realm of access for people in rural communities. Obviously, Pennsylvania is one of the most rural states. It is the most rural state east of the Mississippi River. So a lot of folks that have to travel right now an hour to 2 hours to get this kind of access are going to be able to get it right in their small community hospitals, which is where they want to go for that treatment anyway.
Absolutely. Absolutely. Nursing here. Jen, Tammy, anything else to add? These are two our finest nurses, and they're here, and they do a lot of the telemedicine with the consultants when they call. Tammy?
I think the family really expresses their gratitude of not having to drive the hour down to Allentown. They're working during the day. They want to come see their family member, but they really can't take the 2 hours back and forth. So they're very appreciative to be able to have their family member in a local facility. That's the strongest point from the patient aspect right now.
Yeah. Well, thank you. I know in talking with a lot of folks in the community, that's one of their biggest concerns. That they want to stay local. They want to go see their loved ones, and obviously it's a big cost savings for Medicaid, who we are paying to transport patients. And if we can keep it in our hospitals, it's creating jobs here in our local health providers, and I think it's a great situation. I'm very happy to be sponsoring this legislation in the State House, and I'm going to work hard to see that it's passed.
It's very important, and we appreciate your hard work.
Thank you. That's all the time we have, and thank you for watching Legislative Report. If you have any questions on House Bill 1939 or any other legislation, please contact my office, and the information should be appearing on the screen momentarily. Thank you.